Mr. Speaker and colleagues, let me talk about health. Patients face medicine stockouts, long waiting times, inadequate staffing, and rising out-of-pocket costs. For many families, illness is simultaneously a health emergency and a financial crisis. Somebody once said, most Ugandans are one medical bill away from poverty. The Ministry of Health Sector Performance Report of Financial Year 2024-2025 shows malaria is responsible for 27% of outpatient visits and 19% of inpatient deaths, placing Uganda among the top 10 countries globally for malaria burden. HIV prevalence stands at 5.3%. Tuberculosis affects 200 per 100,000 people, with a 72% treatment success rate against the World Health Organization's 85%. Non-communicable diseases account for 33% of hospital admissions and 11% of deaths, with hypertension affecting 26% of adults and diabetes 5%, mostly undiagnosed. Skilled birth attendance falls to 55% in rural areas against the 74% national average. So the national average looks fair. We need to now address the rural one, because national average is 74%. That's fair. But the problem is now in the rural areas, which we need to address. And a contraceptive prevalence rate of 39% drives a total fertility rate of 4.7 children per woman. The doctor-to-patient ratio in Uganda is 1 to 25,000, in comparison to World Health Organization recommendation of 1 to 1,000. Over 56% of approved health worker posts are vacant, and 60% of Ugandan trained doctors leave the public system within 5 years. The 132.6 billion that is allocated to recruit 16,963 health workers is welcome, but without addressing pay, working conditions, and career development, new recruits will simply accelerate the exodus. They will leave. We also continue to entreat government to abandon the plan to stop facilitating medical interns. This policy is counterproductive. Financing is the most fundamental failure. The financial year 2026-2027 health budget stands at 5.7 trillion, 6.1% of the national budget, and it has remained unchanged from last year, and less than half of the 15% Abuja which we committed to as a country. Government signed this 2 decades ago. Per capita public health spending is at $37, less than half the WHO minimum of $86. National medical stores required 1.5 trillion in financial year 2024-2025 and received 1.4 trillion, while Mulago National Referral Hospital received 18.2 billion against a documented need of 72.3 billion. This is our national referral. Let's fund it more, because that's a 75% funding gap at the country's flagship hospital. Development partners finance 64% of essential medicines in financial year 24-25. Government contributed 36%. Over 41% of health costs are paid directly out of pocket, and 40% of facilities experienced drug stockouts of anti-malarials, antibiotics, and antiretrovirals in 2023. Uganda has got 1 ambulance per 200,000 people. 1 per 200,000 people. That's why colleagues always buy ambulances. Ideally, we should be doing that, but we end up doing it because of this gap. Only 12% of facilities have got functioning emergency units. And referral hospitals operate at roughly 10% of ICU capacity due to inadequate staffing. Mental health apparently is the most neglected area of all. 75% of Ugandans who live with mental disorders receive no treatment. 70% of the Ugandans who live with mental disorders receive no treatment. Only 5 dedicated mental health units exist nationwide. And the sector receives less than 1% of the health budget against a WHO recommendation of 5%.